So we're about halfway through this month, and we've got distractions that are keeping us from some things that we would in a normal May be thinking about as we get ready for summer. We get outside more, we get under the sun more. We've talked in the past about melanoma and skin cancer. We're going to do so again with Dr. Emily Smith from MU Healthcare. She joins us. Dr. Smith, good morning. How are you?
Good morning, David. I'm great. Thank you for having me.
So we talked in the past about Melanoma Awareness Month. How is it different this year than in the past from your perspective?
Well, I think, this year we have big concerns, big societal concerns within our family. And so I think taking care of our skin and protecting our skin seems to drop down on our list of priorities and list of concerns. But I'm hopeful that, we can convince everyone that despite all of that, it is very important to still think about protecting our skin from the sun, but also keeping a close eye on our skin for growths and things that can potentially warrant cancer that could be caught early, and when caught early, are curable.
You mentioned off the air that more people are spending more time outside. We've got more time to do that, and some of our schedules have been disrupted, and so we've sought exercise. I like that. I think that's important, but what would you use as a caution to those who are maybe spending some time and longer time outdoors at this time?
Well, I definitely don't want people to avoid going outdoors. For many of us, that's our change of scenery right now, and we're, confined to our homes largely. It's very important to get outside and enjoy the activities outdoors that we love. But it's important to be cognizant of the sun and to protect your skin when doing so. Going outdoors before the peak sun hours, so before 10 a.m., after 4 p.m. can help. Making sure that you're protecting your skin if you're going to be out during those peak hours. So sunscreen, protective clothing is really a great way to keep your skin safe. Wide-brimmed hats, long-sleeve shirts. And then staying in the shade when you are able to as well are all ways to make sure that you can keep your skin safe while enjoying things outside.
So how our skin is and what happens with skin cancer, that's something that is your job, and you do this every day. Do you find even under the most normal years, even if we weren't distracted by COVID-19 or the coronavirus, that there is a certain fatigue to the message of do proper protection of your skin? I mean, we hear this year after year. I wonder whether sometimes people just say, well, you know what, it's another year. I've not shown any signs of this. I'm not worried about it.
Absolutely. I think that, sun protection, once it becomes part of your routine, feels easy. But for those of us where it has not been part of our routine our entire lives, it feels like a very big step. I mean, applying sunscreen, making sure you have the protective clothing, it is a challenge, and it's something you have to prepare yourself for. And I do think it is something that people do fatigue over because it's a lot easier to run out and enjoy things. It's also easy to fatigue over it when, you haven't personally experienced a serious skin cancer or had a loved one who has gone through the experience of being treated for a more serious skin cancer. And that's when it really puts things in perspective. Most skin cancers are very low risk. They don't spread elsewhere in the body. They can cause, local irritation to the skin and surrounding structures, but in most cases, it doesn't spread. However, there are more serious types of skin cancer, melanoma in particular, that if left undiagnosed or untreated, absolutely can spread and can be deadly. And it is entirely preventable, with sun protection and with early detection. And so I would caution everyone to keep that in the back of their mind. It's like wearing your seatbelt. You hope you never have to deal with an issue where you'll need it. But if you are protecting yourself, should a situation arise, you'll have your protections in place and prevent a more serious issue.
So what do we do? What do we look for? I mean, you mentioned stay out of the sun and when it's highest, and directly in the middle of the day when it could be most potent. So early morning, late afternoon would be times to do things. What else would you suggest?
Absolutely. So, in addition to protecting your skin from the sun, one of the most important things you can do is get to know your own skin and get to know your spots and dots. And so performing a self-skin exam about once a month, or every couple of months is a great way to keep an eye on things. Skin cancer can present in a number of different ways, but it will sometimes show up as a mole that is changing, so changing size, shape, or color, itching all of a sudden persistently, bleeding without being scratched or traumatized. These are all things that we can pick up on our own skin and bring attention to a healthcare provider when needed. And really, we are the best monitors of our own skin. And I find, that patients often have a very good sense of a spot when it is concerning. They often have a good sense, and bringing that to a provider's attention early can result in very early diagnosis and cure.
Are you using telehealth very much in your job?
Absolutely. In dermatology, we have always used telehealth. It's been a great platform for us. Being a very visual field, we can see a lot, via photographs and videos. But of course, in the last, 6 to 8 weeks, it has become a very, very big part of our practice, and we have been using it far more extensively, and it has been a phenomenal resource in triaging, all sorts of skin disorders, but particularly skin spots that people are worried about. And so we have been able to use telehealth. We've had patients send us photographs, and we've done video visits, and we've been able to identify lesions of concern that have warranted an in-person visit. But more importantly, we've been able to provide a lot of reassurance over the video and allow people to stay home and stay safe and out of our clinics when they don't need to be in.
I'll let you go in just a moment. Two things. One on observation. We've had so many cloudy skies, and I don't know if we've had those day after day after day of really hot sunshine days yet, but they're coming, and maybe as early as next week. So I hope this puts into the mind of people that they do need to be aware of their skin care. And then the other is just a question that I have in regard to, I understand little children, they have very sensitive skin. What happens to people as they age? I noticed, and I made this observation to my wife and daughter, that I am at a certain age now, and I said, you know what? I don't turn dark like I used to. I'm not trying to, and I'm not trying to prevent it. I just go about living my life, and I think skin changes when you age too. Is that true?
Oh, it absolutely does. Yes, so children's skin is more thin, but the support structure is definitely stronger. With time, just the natural aging process on aside, our skin does become more thin and fragile, but the exposure to sunlight absolutely expedites the aging process, and so can result in thinner skin and affects the structural support of our skin. So you'll notice as we get older, our skin becomes less elastic. It becomes a little bit more saggy and wrinkly, and so our skin is very dynamic. However, with good sun protection, really you can make a big difference in slowing the aging process of skin.
Dr. Emily Smith, talking about Melanoma Awareness Month. Be aware of that, even during this time of coronavirus. Those are still some things there are many things that we still need to keep our mind on, and that is one of them, especially as we like to go out and enjoy the outdoors during this time as it goes from spring into summer. Thank you again for the visit and the awareness. We appreciate it.
Anytime. Thank you again for having me.
Again, Dr. Emily Smith from MU Healthcare has been our guest. It's KFRU.